Serious health risks from pineapple you may not believe. Pineapple is often praised for being rich in vitamin C, good for digestion, and beneficial for skin health. However, few people realize that if consumed improperly, this seemingly harmless fruit can actually cause up to 13 serious health risks. These include blood thinning, interactions with medications, and even an increased risk of miscarriage in pregnant women. In today's video, I will explain in detail each potential danger of pineapple that you may have never heard about before, along with practical tips to help protect yourself and your loved ones. Have you ever eaten pineapple and felt a burning tongue, swollen lips, or an itchy throat? Many people think this is just a temporary sensation. But behind the sweet and sour taste of this fruit lies a truth that may surprise you. According to health organizations in the United States, thousands of people experience serious reactions each year after consuming pineapple, including allergic responses, digestive disturbances, and even poisoning. What is more concerning is that these reactions are often overlooked, and people only recognize the impact when their bodies have already been affected. We have gathered information from reputable sources such as the American Journal of Clinical Nutrition and the Institute of Clinical Medicine to help you understand this issue and make informed decisions. If you or someone in your family has ever experienced problems after eating pineapple, you will not want to miss this video, and if you still believe that eating more pineapple is always good for you, the following facts may change your mind. 1. Allergies and mouth irritation. One of the most recognizable reactions after eating pineapple is a burning sensation on the tongue, an itchy throat, or mild swelling around the lips and cheeks. You may have experienced these symptoms and thought they were just normal responses to eating a sour fruit. In reality, they are signs of a mild allergic reaction caused mainly by an enzyme called bromelain. Bromelain is a natural compound found in pineapple, especially concentrated in the core and areas close to the peel. This enzyme has the ability to break down proteins and is often used to tenderize meat or support digestion, but in the mouth's lining, which is very sensitive. Bromelain can cause irritation if you eat too much fresh pineapple or eat it on an empty stomach. When this enzyme comes into contact with the tongue, gums, throat, or mouth walls, it may slightly strip away the protective lining, leading to a burning sensation, swelling, and in some cases, small ulcers with prolonged exposure. Many older adults have shared that just a few slices of pineapple can make their tongue feel warm, or as if it is slightly burning. This is not just an imagined feeling, but a real reaction of the body to bromelain. According to a study by Tufts University in the United States, people with sensitive systems, especially children or elderly individuals with weaker immunity, are more likely to experience mucosal irritation after eating raw pineapple. Doctors recommend not eating pineapple on an empty stomach, and especially not eating large amounts at once, as the body cannot neutralize the enzyme fast enough, leading to stronger reactions. A simple yet effective solution that many have applied is soaking sliced pineapple in lightly salted water for about 10 minutes before eating. Salt water helps reduce the activity of bromelain, while also softening the sour taste and reducing the burning sensation. Some people also choose to cook or grill pineapple before eating, as high temperatures break down the enzyme, making the fruit gentler on the mouth and throat. If you have ever felt itching or burning after eating pineapple, you may belong to the group that is sensitive to bromelain, and if there are more noticeable signs such as mouth swelling, rashes around the lips, or difficulty swallowing, you should consider stopping pineapple consumption and observing how your body reacts. If the symptoms persist or worsen, do not hesitate to consult a doctor for proper care. Remember that each body has a different level of tolerance. Some people can eat an entire pineapple with no problem, while others may feel discomfort after just a few bites. That is why it is important to listen to your body and adjust your portions accordingly. 2. Blood sugar spike. Pineapple is a natural fruit. It is not processed and does not contain refined sugar like candies or soft drinks. However, This does not mean that pineapple is harmless when it comes to blood sugar levels, especially for people living with diabetes, prediabetes, or those at high risk of metabolic disorders. Many older adults mistakenly believe that fruit is always good for health, so they eat pineapple freely. In reality, pineapple is among the fruits with a high amount of natural sugar and a relatively high glycemic index. A medium-ripe pineapple can contain more than 120 grams of carbohydrates. This equals more than 40% of the recommended daily sugar intake for an adult. For older adults, the body's ability to process sugar has declined due to weaker insulin activity, a slower metabolism, and less efficient organs like the liver and pancreas. This means that eating pineapple can cause a sudden spike in blood sugar within just a few minutes. This may lead to symptoms like dizziness, fatigue, a rapid heartbeat, or intense hunger even shortly after a meal. According to a study published in the American Journal of Clinical Nutrition, people over the age of 60 who eat fruits with high glycemic indexes such as pineapple, grapes, and bananas are more than 57% more likely to develop metabolic syndrome compared to the control group. Metabolic syndrome is a condition that includes high blood fat, high blood pressure, insulin resistance, and abdominal obesity. These are major factors in serious health conditions such as stroke, heart disease, and type 2 diabetes. In addition, those who are being treated with blood sugar-lowering medications or insulin need to be especially careful with pineapple. Eating too much pineapple while still on medication can cause blood sugar to fluctuate and become difficult to control. Sometimes a mild drop in blood sugar makes the person think they need more fruit, but without understanding their body's needs, this may lead to a sudden spike shortly after. If you love pineapple and still want to enjoy it, consider choosing a variety that is less sweet, cutting it into small pieces, and eating it after a main meal to slow down the absorption of sugar. Avoid eating pineapple on an empty stomach or with other foods rich in carbohydrates. Some experts also suggest that you can combine pineapple with healthy fats, such as unsweetened yogurt or a few almonds, to help slow the process of sugar entering the bloodstream. For older adults or people undergoing medical treatment, it is best to consult with a doctor or nutritionist before including pineapple in your daily diet, even though it is a natural fruit. Pineapple can still be a factor that causes blood sugar to spiral out of control if not used properly. Blood thinning effect. Not many people know that the enzyme bromelain found in pineapple not only causes irritation in the mouth, but also has a noticeable impact on the circulatory system. Specifically, its ability to thin the blood. This effect may offer certain benefits in cases where inflammation needs to be managed or digestion supported. However, for older adults who are taking medications for heart or blood conditions, the natural blood-thinning ability of bromelain becomes a potential danger that must be taken seriously. In modern medicine, people with heart disease, stroke risk, or blood vessel blockages are often prescribed blood-thinning medications such as aspirin, clopidogrel, or warfarin. These medications help prevent blood clots from forming, which can otherwise cause heart attacks or strokes. However, because these drugs already thin the blood, the body becomes more sensitive to any additional agents that increase bleeding risk. Bromelain in pineapple is one of these agents. If you eat pineapple while taking anticoagulant medications, the combination of the natural enzyme and pharmaceutical drugs can lead to poor control of blood clotting. As a result, even a small cut might take longer to stop bleeding. More dangerously, if you have recently undergone surgery or are preparing for an operation, eating pineapple can increase the risk of internal bleeding, making it hard to manage blood loss. There have been cases where patients appeared to be recovering well after surgery, but experienced complications simply because they continued eating pineapple during the recovery phase. Common signs of bleeding disorders include unexpected bruising on the skin, frequent nosebleeds, or bleeding gums while brushing teeth. If you notice these symptoms happening more often after eating pineapple, it may be a sign that bromelain is interfering with your blood clotting system. According to recommendations from the National Institutes of Health in the United States, People who are taking blood thinners should completely avoid pineapple for at least 2 weeks before and after surgery to ensure safety. Likewise, those with a history of gastrointestinal bleeding or who bruise easily should also be cautious when consuming this fruit. In conclusion, pineapple is not a forbidden food, but it requires awareness and knowledge when used, especially for those receiving treatment for blood or heart conditions. If you fall into this category, asking your doctor before eating pineapple is a necessary step. Do not skip this just because you believe that pineapple, being a natural fruit, must be safe. 4. Medication interactions. In modern life, especially for older adults, taking medication daily has become a familiar routine. However, something that is often overlooked is that certain foods, which may seem harmless, can directly affect how medications work. Pineapple is a clear example. This tropical fruit not only contains the enzyme bromelain, but also has the ability to change how the body processes certain medications, which may lead to unwanted side effects or reduce treatment effectiveness. Many clinical studies have shown that bromelain can increase the absorption of some antibiotics, especially those in the penicillin group like amoxicillin or the tetracycline group. At first, this may sound like a good thing, but in reality, it can cause the concentration of the drug in the blood to rise too high, making the body react more strongly than it should. Common symptoms include mild fever, dizziness, nausea, bloating, or chest tightness. These signs are often mistaken for the illness getting worse, but in fact, they are caused by the interaction between the drug and pineapple. Besides antibiotics, pineapple also affects medications for epilepsy, blood pressure, and even antidepressants for seizure medications. Bromelain can interfere with liver metabolism, making the drug clear out of the body either too quickly or too slowly. This could lead to an increased risk of seizure recurrence or cause side effects if the drug level suddenly spikes. One case, reported in the Journal of Clinical Medicine, involved a patient being treated for anxiety with a mild sedative. After eating large amounts of pineapple for several days, the patient began to experience a rapid heartbeat, restlessness, and had trouble sleeping again once pineapple was removed from the diet. The symptoms clearly improved, confirming a direct link between the fruit and the drug's effectiveness. To reduce this risk, experts recommend that people taking chronic medications should avoid eating fresh pineapple right before or right after taking medicine, especially within 1 or 2 hours if you take medication daily. Ask your doctor whether your specific medication may interact with bromelain. In many cases, simply adjusting the timing of when you eat pineapple or reducing how often you eat it can help manage the risk. Food can be a partner to medicine, but it can also be a silent disruptor if we are not careful. In the case of pineapple, being careless may lead to serious consequences, especially for those going through important treatment plans. 5. Enamel erosion and gum irritation. One surprising fact about pineapple is that this juicy and delicious fruit can directly affect oral health. Many people have reported that after eating pineapple, their teeth feel more sensitive. They experience discomfort when drinking cold water, or they feel a slight burning sensation in their gums. These symptoms are not random. They come from the high acid content in pineapple, which is often overlooked but can cause long-term damage to tooth enamel if not managed properly. Pineapple contains a lot of organic acids, especially citric acid, which can soften tooth enamel if consumed frequently or in large quantities. Enamel is the tooth's natural protective layer, shielding it from hot, cold, or acidic food. When enamel is eroded, teeth not only become more sensitive, but also more likely to become discolored, develop cavities, and are harder to restore. The concern is that once enamel is damaged, the body cannot regenerate it the way it can with other tissues. For older adults, especially those with weak teeth, thin enamel, or dental work like dentures or crowns. The impact of acid from pineapple is even more noticeable. Eating pineapple while already having inflamed gums or gum disease can increase discomfort and delay healing of the affected areas. Brushing teeth immediately after eating pineapple is also a common mistake, when enamel is softened by acid. Brushing at that time may strip off the outermost layer even more, causing permanent damage, according to dentists at Harvard University. If you have just eaten pineapple, it is best to rinse your mouth with clean water to neutralize the acid. Then wait at least 30 minutes before brushing your teeth to better protect the enamel. You can also eat pineapple with foods rich in fat or calcium, such as low-salt cheese or unsweetened yogurt, to reduce acidity from the start. Another helpful tip is to choose pineapples that are moderately ripe instead of ones that are overripe or still green. Evenly ripe pineapples tend to have lower acid levels, causing less burning and having a milder effect on enamel. You should also avoid eating pineapple right before bed, because during sleep, the flow of saliva decreases, allowing acid to stay in the mouth longer and increasing the risk of harm. Oral health is not only the gateway to the digestive system, but it also greatly affects quality of life, from eating to speaking. So, if you want to enjoy the fresh and pleasant taste of pineapple while keeping a healthy smile, remember to protect your enamel and gums with small but practical habits every time you eat this fruit. 6. Breathing difficulty in people with allergic conditions. For most people, eating a few slices of pineapple is simply an enjoyable taste experience, but for some individuals with sensitive immune systems, especially those with a history of food allergies, allergic rhinitis, asthma, or weakened immunity, pineapple can become the trigger for a serious reaction, including difficulty breathing. When a person is allergic to a component in pineapple, their body treats the fruit's natural proteins as dangerous invaders and immediately activates an immune response. This response releases substances such as histamine into the bloodstream, causing a range of symptoms from mild to severe. At the mild end, you might experience itching in the throat, sneezing, nasal congestion, or slight wheezing after eating. In more serious cases, the reaction can develop quickly, causing tongue swelling, throat inflammation, and breathing difficulty. In some situations, the person may suffer from low oxygen levels, a drop in blood pressure, dizziness, or even loss of consciousness. These are typical signs of anaphylaxis. One of the most dangerous aspects of this condition is that it can occur quietly. Even if you have eaten pineapple before without any symptoms, this is because allergic reactions can develop over time. Or the immune system may become weaker with age. Older adults, especially those who already have respiratory conditions such as chronic asthma or lung disease, or who are taking medications that suppress the immune system, are more likely to have a stronger reaction to allergens found in food, according to the American Academy of Allergy, Asthma and Immunology. Individuals who have a history of allergies to pineapple or to other enzyme-rich fruits like kiwi or papaya should be particularly careful, because the risk of cross-reactivity is high. A cross-reaction happens when the body confuses proteins in pineapple with those from another food it has previously reacted to. This explains why some people who have never had issues with pineapple in the past may suddenly develop a reaction after just one meal. So how can you recognize and prevent it? If after eating pineapple you feel itching in your mouth, wheezing, or have trouble swallowing, stop eating immediately and monitor your condition for the next few hours. For those with known allergic tendencies, it may be safer to try a small amount of cooked pineapple instead of eating it raw, since heat can reduce the strength of the proteins that cause reactions. If you are currently taking allergy medication, ask your doctor whether you can use it preventively before eating foods like pineapple that are more likely to cause allergic responses. In severe cases where symptoms such as throat swelling, difficulty breathing, rapid heartbeat, or dizziness appear, go to a medical facility immediately. these may be signs of anaphylaxis, which is a medical emergency that must be treated promptly. If you have been prescribed an epinephrine injection by your doctor, use it as soon as the severe symptoms begin. We often assume that fruit is completely harmless, but that is only true when the body can safely tolerate it. Pineapple, while rich in nutrients and full of flavor, requires careful attention, especially from those who have a history of reactions to food, pollen, or other allergens. After going through 6 common but often overlooked risks associated with eating pineapple, you may now realize that not all foods that seem healthy are automatically safe for everyone. Pineapple is a tasty fruit, rich in nutrients, and offers many benefits for digestion, skin, and immunity. But if eaten at the wrong time, in excessive amounts, or without understanding your own body and health condition, this seemingly harmless fruit may trigger a chain of unwanted issues. These range from mouth irritation and blood sugar spikes to medication interference, breathing problems, or tooth enamel damage. The most important thing is not to eliminate pineapple from your diet completely, but to learn how to eat it properly, choosing the right person, the right timing, and the right amount for older adults, especially those who are managing chronic conditions, taking medications regularly, or have weakened immune systems. Understanding how foods affect the body is an essential part of proactive healthcare. If you still enjoy the refreshing, mildly sweet flavor of pineapple, consider safer preparation methods such as grilling, lightly boiling, or combining it with neutral foods to reduce its acidity. Don't forget to listen to your body after every meal, because small signs like a scratchy throat, mild stomach pain, or tooth sensitivity may be your body's early way of warning you. I hope today's message has provided you with useful and practical knowledge to help you make smarter food choices, not only for yourself, but also for your loved ones. Remember, health begins with small decisions, and nothing is more valuable than understanding and caring for your own body every day.